When doctors say this has a risk, they don't mean what most people think. If you want to find out how doctors calculate risk, make sure to watch this video. Doctors define risk using two dimensions, likelihood and consequence. Likelihood asks how often an event usually occurs. Consequence, on the other hand, tells you how bad it is if it happens. For example, take a CT scan with contrast. A severe allergic reaction is rare, but if it happens, the consequence can be severe. So even a rare event still matters if the outcome is serious. Now doctors combine likelihood and consequence into a risk matrix. Low likelihood plus low consequence is low risk. High consequence, even with low likelihood, can still mean high risk. At the same time, risk is not the same for everyone. Let's take a look at our CT example. An older patient or someone with kidney problems has a higher risk. Drinking enough fluids, using modern scanners, and giving protective medication can lower that risk. So, this is why doctors look at the patient, the situation, and the treatment together. Any factor has the potential to change the risk equation. This is why doctors don't just say yes or no. They weigh benefit against risk and involve the patient in the decision-making process. For our CT scan, this means that if the scan could potentially detect a life-threatening condition, a small but serious risk may be worth taking. Let's take a look at what we learned. Risk is not just how likely something is, it's likelihood times consequence. That risk changes with patient factors, environment, and medical interventions. The goal is not zero risk. The goal is for patient and doctor to make an informed decision.